Dear Mary Paul, dear Charles, Excellencies, today marks 3 years since I declared COVID-19 a public health emergency of international concern. The rapid development of vaccines, diagnostics, and therapeutics against COVID-19 was a triumph for science. But inequitable access to those tools has been a global failure that has hampered the response. The new strategy for the medicines patent pool offers a way forward. The local production of vaccines, diagnostics, and therapeutics in low and middle-income countries is critical to addressing inequities and for strengthening preparedness for future health emergencies. Local production depends on non-exclusive licensing and technology transfer. 2 years ago, WHO and MPP launched the mRNA Technology Transfer Hub in South Africa, which now has 15 country recipients around the world. In 2020, we also established the COVID-19 Technology Access Pool, or CTAP, a voluntary mechanism to rapidly share knowledge, intellectual property, and data on innovative health technologies. I urge all countries to use all the available tools they have to facilitate local production, including TRIPS flexibilities and pooling mechanisms. I also encourage intellectual property holders and manufacturers of life-saving health products to support the mRNA Hub and CTAP. My thanks to the Medicines Patent Pool for its continuing partnership as we work together to make life-saving tools accessible and affordable for everyone, everywhere. I thank you.
Dear honorable guests, member states representative, valued partners, and distinguished panelists. As the chair of the board of EMPP, I have the honor to welcome you today at this event, during which we'll be launching MPP's new 3-year strategy for the period 2023, so starting right now, to 2025. Since its inception in 2010, MPP has signed more than 37 licenses for various health technologies and facilitated access to over 30 billion doses of treatment in 148 countries. As we venture into this new strategy, the MPP board is convinced that our model is more relevant than ever. Access inequities that have existed for decades were exacerbated, as we all know, during the COVID-19 pandemic. And this has reminded us all that a lot remains to be done to make sure that innovative health technologies that could save many lives reach all those who need them, regardless of where they live. The strategy we have developed is both ambitious and achievable. Ambitious because we aim to expand the range of products, diseases, and technologies that work on to enable more people to have affordable access to the innovative health tools they need. And also ambitious because the targets and impact indicator we have set for ourselves will require us to be more focused than ever and to work closely and tirelessly with our partners, with you, to achieve them. But it is also achievable. It is achievable because it is based on extensive interaction and consultation with many of you to understand how MPP can achieve the greatest impact with the mandate, resources, and expertise that it has at disposal. It is also achievable because it builds on the work we have done together over many years to lay the groundwork for many projects we are involved in, some of which we hope will bear fruits over the coming 3 years. I will now give the floor to Charles, the Executive Director of MPP, who has masterfully, thank you, Charles, led the organization over the past 4 years and will be leading it into its new strategic period to give you a flavor of some of the key features of the strategy. Over to you.
Thank you very much indeed, Marie-Paule, and I would like to add my welcome to you all to Marie-Paule's. So the strategy that we're launching today really provides a clear path for MPP to contribute to more equitable access to treatment and prevention tools in low and middle income countries. And it focuses on these 5 strategic goals, which are up behind me rather, and you won't be able to see them. So they're also on the little flyers on your chairs, in the bags that you got. And as you will see, if you can find them, these goals seek to basically consolidate the work that we've been doing over the past few years in infectious diseases like HIV and TB and hepatitis, as well as establishing more firmly MPP's model in non-communicable diseases and maternal health, areas where I really feel that our model has an increasingly important role to play. And these goals also highlight some of the new technologies that MPP is working on, long-acting therapies, biotherapeutics, mRNA vaccines, as well as our ambition to contribute to combating health emergencies and to support the development of sustainable and geographically diversified manufacturing in low and middle income countries. Our target is to facilitate almost 90 million patient years of treatment over the next 3 years, by providing treatment to approximately 30 million people each year by 2025. And in relation to this, I'd like to make 3 points. And the first one is that while we work on licenses and their implementation, we must remember that this is all about people. People who have the right to access the best possible health tools, regardless of where they live. And secondly, as Marie-Paule has mentioned, we have to remember that we cannot do this in a vacuum. We are absolutely reliant on partnering with all of you to achieve our targets. And finally, in such a fluid world, we need to continuously learn from what we do, from what works, and also from what doesn't work. Learning and refining our strategy is going to be a key part of what we do going forward. So I really think the next 3 years are full of opportunities. The current major focus on equitable access is the perfect environment for MPP's work. And we're committed to turning those opportunities into real impact for the people in low and middle income countries who need the affordable medicine and other medical products that we can facilitate. So thank you all very much for coming today and all of those who are joining online. And now I invite you to have a look at a brief animation to set out in a bit more detail the 5 strategic goals. Thank you.
I am delighted to be talking about the Medicines Patent Pool, or MPP, at the launch of their 2023 to 2025 strategy. It's a sad but inescapable fact that half of the populations living in low and middle income countries, or LMICs, still lack proper access to essential medicines and healthcare. Millions of people face health expenditures that drive them into poverty. COVID-19 has made the situation even worse. MPP's mission is to increase equitable access to affordable medicines and other health technologies through licensing and technology transfer. It does this through partnerships with industry, government, civil society, and other international organizations. Since 2010, MPP licensees have supplied over 30 billion doses of treatments in 148 countries. And now MPP enters into an exciting new phase with this strategy. By 2025, 30 million people will be accessing MPP licensed products every year. That's up from 15 million people annually between 2018 and 2022. 5 core goals will achieve this. Goal 1 is to expand access to innovative medicines for infectious disease like HIV, hepatitis, and tuberculosis. MPP will seek to improve treatment and prevention of these and other diseases by licensing innovation, facilitating the development of quality-assured generics, including new formulations for children, and joining with stakeholders to support expanded access. Goal 2 is to establish voluntary licensing as an effective access mechanism for non-communicable disease and maternal health. MPP will license innovative treatments that can improve care standards. MPP will be doing this for both non-communicable disease and maternal health in low and middle income countries, and also supporting their rollout with partners. Goal 3 is to facilitate development and access to new medical technologies. MPP will form strategic partnerships to support development and access to long-acting technologies that require less frequent doses. It will also contribute to accelerating access to biotherapeutics and the development of sustainable mRNA vaccine manufacturing capacity in low and middle income countries. Goal 4 is to accelerate access to countermeasures for pandemics and other international health emergencies. MPP will continue to help address inequity in access to health tools by seeking to integrate licensing and technology transfer into future pandemic preparedness and response. And Goal 5 is to support a diversified and sustainable manufacturing capacity. MPP will help improve security of supply through licensing to qualified local and regional manufacturers across all regions. It will also provide technology transfer support to manufacturers in low and middle income countries, particularly for mRNA vaccines, biologics, and complex small molecules and formulations. And now, here is how MPP will achieve these goals. Firstly, it will prioritize health tools where the licensing is likely to yield the greatest impact for public health, and this will include focusing on technologies earlier in the research pipeline. MPP will also adapt its licensing model to include a broader range of diseases and technologies, and this will enable more people to benefit from affordable access. To address access challenges more holistically, MPP will develop partnerships with a wider range of partners. Finally, MPP will promote transparency by openly sharing patent, license, and regulatory information through various platforms. Close to 90 million patient years of products will be supplied by MPP licensees over the next 3 years. And this will create savings of over $1.2 billion for the global community. If you want to know more about MPP, you can check out their website here. Thank you for watching.
As staff of MPP, we are delighted to be here with you and to moderate this session this evening at the launch of our new strategy. My name is Meghmala, and I have here with me Julia. We have the pleasure to welcome amongst us Mr. Love Agarwal. He's the Additional Secretary at the Ministry of Health and Family Welfare at the Government of India. And our first question is for you, Mr. Agarwal. So over the past 3 years, the COVID-19 pandemic has had a significant impact on our lives and exacerbated many of the inequities in access to health products that were already there before. India now has the G20 presidency, and this comes at a time in which the world reflects on a future global health architecture that better caters to the needs of all. So the question is, what do you think is needed to improve equitable access to health products, not just during pandemics, but also beyond? And what role do you think is there for licensing and technology transfer in this context?
Thank you. At the outset, let me thank Ms. Clenny, Chairperson for Governance Board, as well as Mr. Charles for launch of the Medicine Patent Pool Strategy for 23-25. And as you rightly mentioned, COVID-19 response brought to the fore the inequities which exist in terms of R&D, in terms of production, and also in terms of absorption of medical countermeasures. We had seen that while we had R&D and manufacturing, which was being promoted, still there were inequitable availability and utilization, primarily because of lack of resources in Global South. The COVID-19, as we're all aware, once a century crisis, also brought to fore the need for an equitable and effective mechanism for sharing of intellectual property, focusing on transfer of technical skills and data as a key element to save lives. And as you further highlighted, with India's G20 presidency, with that in context, we had actually proposed creation of R&D and manufacturing networks for vaccines, therapeutics, and diagnostics as a major priority in the health working group, with focus not only on access and availability, but also with focus on affordability of these medical countermeasures. With waning trajectory of COVID-19, Dear colleagues, the need for continued momentum on pandemic management and being prepared for future cannot be lost sight of. And question today, we all know that it is not that if we will have any future pandemic, but the question is when we may have our future pandemic. And hence we need to be prepared to ensure that we have surge capacities for MCMs and a sustainable model to produce these medical countermeasures at scale. You mentioned very rightly the focus on licensing and technology transfer are going to be very critical components to help support such diversified and sustainable manufacturing capacity at local level, at regional level, and will also ensure affordable access to the pandemic as well as non-pandemic health products, specifically in LMICs. Understanding we have gained with global immunization programs for vaccine preventable diseases, production of influenza vaccines through WHO Hub. These have established that licensing and technology transfer would be an important pathway to support local manufacturing and to enable manufacturers in LMICs to rapidly integrate new technologies and respond to public health needs. Voluntary licensing from original patent holders can actually allow millions of people to have timely access to medical countermeasures, and voluntary licensing mechanism for emerging diseases as well as diseases with pandemic potential could actually be a way forward as exemplified by AstraZeneca during COVID-19 pandemic. Voluntary licenses are generally royalty bearing. What we would like to suggest, royalty-free voluntary licensing could also be considered by patent holders for LMIC, especially when the R&D for the product has been publicly funded. It is in this context, we also are aware that if there is a failure to secure voluntary mechanism for technology transfer, when it comes to saving millions of lives, compulsory measures such as TRIPS waiver or the use of compulsory licensing have also been advocated and resorted to by member states. In the end, I would like to specifically highlight that licensing and technology transfer for future pandemics and public health related issues would require broader partnerships between originators, recipients, and the facilitators. And this would then, in that context, require creating an enabling environment facilitated by member states, WHO, and its partner organization, I see UNITAID being present here, MPP, CEPI, Gavi, donors, including multilateral organizations like G7, G20, and others. Thank you.
Thanks, Mr. Agarwal, for your insights. And we understand that you have to leave for a prior engagement, but thanks for your presence here, and we're really grateful.
We will now continue with our first panel, and I would like to welcome Philippe from UNITAID, Helen from Viv Healthcare, Denise from Cormor Cancer Foundation from Nigeria, and Carrie from the Union for International Cancer Control. And in this first panel, we would like to unpack the first two goals of our new strategy. But we also would like to hear from our partners the important linkages with your own work. So since its inception in 2010, MPP has worked in the infectious disease area with some important achievements, and we do hope to do more. And our first question is for Philippe, because MPP, as I said, was funded in 2010, and it was set up by UNITAID. It has grown from its original focus on HIV and is now also covering not only HIV, but also tuberculosis, also viral hepatitis, COVID-19, and non-communicable diseases. So the question is, how relevant is MPP model in today's work, and how does it now fit within UNITAID's own ambitions?
Thank you, and good afternoon, good evening to everybody. I'm very pleased to be here. As you said, we have been, as UNITAID, the first believer in the medicine patent pool, and we are still a strong support and believer because we believe that it's part of the solution. UNITAID, as said by Marie-Paul, is looking at access to innovation. So for us, it's saving life, saving time, saving money. If you look at the overall portfolio we have in access to innovation, the projection that we did with the Global Fund is that the savings for the next 7 years is 7 billion. We need to recalculate because even with your partnership, we are doing better. If you look at dolutegravir, for example, in South Africa, we have a decrease of price over the last year. So for us, it's a success. Nothing was granted at the beginning. So thanks to the work of the team, thanks for the work of the board, Marie-Paul and Charles and all the people here. I think it's a demonstration that negotiation, deal with industry originator are very important to create the condition to develop generic markets. So beyond that, it's more than a proof of concept. It's a proof of impact. And I think that we are very glad to see the new strategy. As you mentioned, it's not just only the scope with beyond the infectious disease, is for us, and it's linked also with our strategy, is a new way to think about access. So it's looking at transfer of technology when needed. And I think that we have a good example with the work that you are doing with WHO in the RNA platform. It's also embarking and looking to, I voluntarily say, regional production more than local production, because I think it's important to have an idea of the market. That's also the key factor for the success. And you have, with the team, you have discussed that during the G20. And also, we have a green initiative. So we believe that, you know, the global warming is a question for global health. It represents 4% of the global footprint. And I think that we have a lot of things to do together and to work with industry to get it right or better. So again, new dimension of access. We are very supporting. We like it very much. And as I say always, frankly, for us, what we do is about people, is about products, of course, but it's also about partnership. So 3P and not 2P like the MPP. But we were with Charles sitting in front of the panel of the G7 together. We were the only two organizations together to explain how we can together drive the response. And I think that it's something that we have to do more. And we are really happy to do more in different audiences, G7, G20, India, Presidency of India is very important. And so we will continue and we are really happy to do that.
And
thank you.
Thanks a lot for the continued support and for the enthusiasm.
Our next question is for Helen. With VIV, we have two very important licenses. There's one dolutegravir for HIV treatment, and then more recently, we have cabotegravir long-acting for HIV prevention. The question, Helen, is then, what lessons have we learned in terms of access to HIV treatment as well as prevention tools? And how was this partnership between MPP and VIV contributed to the global HIV response?
Thanks, Megan, and thank you to the MPP team for the invite to be here tonight. It's a huge privilege to be here with such a key partner of ViiV. I work for ViiV Healthcare, and for those of you who are not familiar with ViiV, ViiV is a global biopharmaceutical company that is 100% focused on HIV. You may be more familiar with our shareholders, which are GSK in the majority, but also Pfizer and Shionogi. We're born actually just a little bit earlier than the MPP, just over 13 years ago, to be 100% focused on HIV. And whilst our predominant piece of work is to innovate around the science, bringing technology and talent together to innovate, to develop medicines for treatment and prevention and ultimately cure, we know that what's also core is innovating for access, because if those medicines do not reach the people who can benefit from them, we won't reach our goal of ending HIV by 2030 as a public health threat. And what has been core to our approach and delivering the success we've had so far has been partnerships. And our strongest partnership in access has been with the Medicines Patent Pool for nearly 10 years. And just to give you an idea of the magnitude, so at the end of last year, around 21 million people living with HIV were accessing dolutegravir because of the voluntary license agreements that we have with the MPP. Now, that represents over 80% of people who are on antiretroviral treatment for HIV in the world, which we are immensely proud of. Now, it's been a long partnership, and we're really proud of also as to how that has evolved over time. And I think the biggest lesson that we've had is one size does not fit all. And whilst there is the foundation of IP sharing, what we've learned and iterated over the years is how you need to change the terms and think about the other tools and terms of the license and the additional partnerships that are needed to supplement the license in order to deliver on that shared goal of access. So some of those have been where with pediatrics, we've had additional partnerships to build on the IP, to do technology transfer and have incentives for the generics to really motivate them to accelerate their programs. In others, we've built a separate and totally new, unique model in upper middle income countries that was really driving to make more affordable access to medicines in a category of countries that do have more economic ability to pay for medicines. And so we feel they should contribute to the innovations of tomorrow, but equally they need to support the people in their countries. And so we were able to experiment with the MPP and design a new model, and that has delivered on its goals. And we still look forward to seeing how that progresses even further over the coming years. The next big hope and our biggest focus of today is in the prevention space. We are lagging behind in the HIV response. And we do have a product that has demonstrated huge potential. It's not a straightforward product. It's a long-acting product. But we are walking into this license, eyes wide open, collectively together in a spirit of collaboration to find the right partnerships to build that license to make it successful. And that's what we're really looking forward to. And over the coming days and weeks and months and years, we know that collectively by working in partnership, we'll make it happen.
Thanks so much, Helen. Really appreciate that response. And we really look forward to our continued work with Viv. Thank you.
Our second strategic goal takes us into our work in non-communicable diseases, or NCDs, as we commonly call them. And here we would like to talk more about non-communicable diseases and the various access challenges that patients face, especially on access to cancer treatment. And our question is therefore for Denise. As a cancer patient and as a cancer survivor from Nigeria, can you tell us more about the challenges in accessing timely diagnosis and affordable diagnosis and affordable treatment and care in low middle income countries?
Thank you very much for, firstly, the opportunity to be able to talk about this. And I am a patient advocate. So a cancer patient advocate. As a cancer survivor from a low middle income country, I am now in a position to reflect on my experiences as a patient and what's going on in the space today. I was diagnosed about 6.5 years ago with breast cancer with a metastasis to the brain. And at the start of the journey, which is very interesting, was the fact that it first took about a year for us to come to the conclusion that I did have cancer. So that was first a starting point. And that was through going from 3 very, very high profile hospitals in Lagos to somewhere in Minna in Nigeria, and then on to Abuja and No Hope. But eventually, one hospital had just brought an MRI machine, and I was opportuned to, a doctor friend of mine said, look, you don't meet any criteria for any major illness. So you know what we're going to do? We're going to just give you just have an MRI scan. And if it's clear, then we know you're good. And I thought, okay, fine. First and foremost, you have to first find the funding for that. So I had to, friends and family help to raise that funding, and I had it. And I was diagnosed with cancer, and I was told I had, it had moved. So I had more than one tumor, which didn't make sense to me. So please understand that. I didn't know that what it meant. And I had less than roughly about 3 months to live. I'm here 6.5 years on, we're still fighting. So I want to talk about the challenges, It's important to recognize that there are less than 70 qualified oncologists working in Nigeria. And we have a population of over 200 million people. As of 2022, we've now been able to get a PET scan machine. And for anybody to have the scan, it will cost you about £500. And the average income of a Nigerian low income is 30,000 naira, which is equivalent to less than a pound or £10. It's ridiculous. We do not have cancer centers. We don't have that. So we have cancer treatments. We have cancer treatment centers that do the treatment, but we don't have like a cancer, like you say, I've got a cancer hospital, like I have where I go to now. And we have radiotherapy centers, and that's two in Nigeria. I think one in the north, one in the south. When you look at the treatments that we have, cancer is not free anywhere in Nigeria. It's not free anywhere. So sorry, I thought my voice was loud. Thank you. It's not free anywhere in Nigeria. So it's anybody that has cancer has to source the funding for your treatment. But I would like to say that NGOs in Nigeria do play a very big role in helping people raise funds. And I am aware today that palliative care treatment as well is funded by individuals, and all the multidisciplinary treatments that we have to go through, we don't have, unless you have the money, you are not going to get it. So let's look at it from that. But one of the things I take pride in, and I'm very glad about, was I was born and brought up in Nigeria. And I had access to public health care as a child, even when typhoid fever was one of the first people to have it. And today I sit here, and it's very heartbreaking to admit that a Nigerian with cancer has a very 80% of Nigerians with cancer do not have the chance to survive. 20%, let's hope, but that's where we are as of today. So those that make those decisions, we need your help. At least I stand for us as cancer patients. We need your help. Thank you.
Thanks a lot, Denise.
Keeping up with that train of thought and moving on, MPP recently signed its first ever license for a cancer drug. We recently signed the license for nilotinib with Novartis, and we're now partnering with UICC and many other stakeholders through the Access to Oncology Medicines Coalition, or ATOM for short. So our next question is for Carrie. How do you think that MPP's licensing model could make a difference in the field of oncology?
Oh, thank you very much for the invitation. And I actually, everything you just said was bringing to life what I was going to say, that your story and the story of Nigeria is replicated in low middle income countries around the world. We have 70% of cancer deaths of the 10 million occur in low and middle income countries because presentation is late. It's already metastasized, because the primary healthcare can't recognize the cancer, because the diagnostics and pathology are not available, and because there's not trained oncologists or radiotherapy or surgery in place to address where the burden of cancer will grow the most in the next 20 years, 70% of the growth. So UICC is an organization which is passionate about people avoiding cancer and then getting access to the treatment and care that they need in order to survive their cancer. There's a whole shed load of things that we have to put in place in order for that to be successful. I recall a meeting with Charles and the team a year and a half ago when negotiations with the pharma companies, the biopharma, were somewhat complicated and difficult. And quite rightly, and I understand this, the pharma companies were saying it's complicated cancer. Okay, it's not just about getting a medicine into a country and making it available. The complications of the diagnostics and pathology, sometimes the pathology and diagnostics are more expensive than they are the medicine. So how do we solve that problem collectively? And I agree with what you said earlier. This is all about partnership. So out of those conversations, we established that, well, let's get all of those organizations around the world who have a passion for access to oncology medicines, together with the biopharma, the generic manufacturers as well, because we need the generics there as well, not just the latest medicines. And can we form a partnership which is going to address all the component parts that become the problems that stop, at the end of the day, a patient like you receiving exactly what you need, where if you were in another part of the world, you'd receive it fairly quickly. So what can we do collectively? Now, the Atom Coalition now has these 45 organizations, including industry partners, diagnostic partners, people who are experts in pathology, people experts in cold supply chain. All the experts are together, and we're delighted that through Novartis, we've secured our very first VL. But where are we going? I love the 3-year plan. Thank you to the board of MPP for continuing to support the NCD community. And as a board member of the NCD Alliance, I would love to see it expand beyond cancer to the other diseases. But where do we want to go? 3 years is not a long time in this space. It really isn't. My ambition is that we create an opportunity with the Atom Coalition MPP that when a Pfizer, a Sanofi, a Novartis in future have a blockbuster drug, which they are going to launch next year in America and also Europe, they will come to MPP and the Atom Coalition and say, how do we get this into low and middle income countries quickly? Because the current models of donation are not sustainable. And the other alternative is waiting for the patent to run out, which means countries like Nigeria won't get that medicine for 10, 15 years. That is a moral dilemma and something we need to address. If we can get Atom working well with MPP, we can resolve the long-term issue of getting new medicines to the right person at the right time. But it's a partnership approach that we have to implement. So delighted to be here, and thank you very much for the invitation.
We do have one last question, very quick, but potentially challenging for all of you. So in one sentence, and that's the challenge, you only have one sentence. If you have one ask for MPP during this strategic period 2023-2025, what would that ask be in one sentence? And Carrie, you're already holding the microphone. Maybe you can start.
I love the commitment to new VLs. Let's see how many cancer VLs we can get in the next 3 years.
Providing capacity building to increase patients' voices on the negotiation table will be my ask. This is because it acts as a catalyst to the process of documenting challenges of access to treatment, which will be used to inform policy decisions on improving access to treatment in low middle income countries.
So mine is really based on the increasing network of manufacturers that the MPP has through its expansion of strategy and licenses. And that is an ask to make sure that you leverage the unique opportunity that gives to drive standards in environmental sustainability, as well as social impact. I do think it's really important that we don't always think about human health at the consequence of nature and climate change.
I think we need to use what we have learned to accelerate access to important innovation. That's my sentence.
My last thing is that I really would like to thank you. We really would like to thank you a lot for being here and for sharing such all your experience and all these very important insights. So as we welcome the second panel, I just want to remind for everybody who's following online that the question function is open on Zoom. So please share. I don't know where the online people is, but share your question. And you also will be able to send an email to an email address that is going to be shown at the end of the presentation. And for everybody who's in the room, MPP, the all MPP team is here. So please ask all your questions to us later, and we will be able to try to answer. Thanks a lot.
Thank you to the first panelists and moderators. Good evening, everyone. I'm Lobna, and it's my pleasure today to be here with Tiwa and continue the discussion with our second panel. With us today, we have Nombeko from the Desmond Tutu Foundation, Jay from the Access to Medicines Foundation, Rahul from Hetero, and Martin from the WHO. Let's dive in with goal 3, and it's about facilitating development and access to novel medical technologies. So, as you may know, long-acting technologies offer the opportunity to have different way of administrations with less frequent dosing in novel modalities, and therefore it could simplify treatment and prevention. So the first question is to you, Nombeko. So as a person living with HIV and also working in the HIV prevention space, at community level in South Africa, how important are these long-acting technologies and what potential do they hold according to you?
Good evening, everyone, and good morning to those who are looking online somewhere in the morning countries. It is very important that long-acting injectables are available. In low and middle-income countries, sex is not by choice. Engaging sex is compromised by many circumstances. Not every young girl and a woman wants to engage in sex. And most prevention products that are available might be accessible. But the question is, are young people able to use them? If you are in this space right now and you want to take your PrEP, are you able to use your PrEP without feeling intimidated by those around you? And that says, if you've got the long injectable within your system, that gives you the voice and it revolutionizes your life. It revolutionizes your health. So we need long-acting injectables as in yesterday. Thank you.
Thank you, Nombeko, for these insights.
Good evening. Let's take additional moment to look at biotherapeutics. Biotherapeutics, such as recombinant protein and monoclonal antibodies, have become mainstays in the treatment of many diseases. The proportion of biotherapeutics in new drug approvals has significantly increased in recent years, as many of us know, just as the number of biotherapeutics included in WHO essential medicines list. So our next question is to Jay. What challenges do you see in affordable access to biotherapeutics in LMICs? How can such challenges be addressed? And what role can MPP play? Thank you.
Well, thanks for the question. And I'm glad that this question also allows me to talk a bit about some of the solutions that are there, not only on the challenges. I would signify the challenges into 3 categories. First part is that regulation, because biological products are complex to manufacture, and the regulatory pathways that are there are difficult to maneuver for many manufacturers, large and small. And registration is also extremely diverse in different countries. So one of the key solutions there is more usage of WHO-approved qualifications, more usage of collaborative registration procedures, and potentially the usage of regulatory waivers where possible would be, I think, really important to overcome some of these challenges. I think a second component challenge is in financing, as a lot of time biotherapeutics are not financed by health systems, not reimbursed by health systems. So this becomes a huge barrier that prevents access for patients living all around the world. And a third component, which I think is being solved, and I think the previous panel spoke to a little bit about some of their efforts, at least in cancer care, is that not always is there an availability of a delivery mechanism, whether it's infrastructure, capacity, or technologies to be able to deliver on these biotherapeutics. But that can also be overcome by the ambitious strategy that is presented here in front of us, and the many partners that are here to support that strategy and partner with that to solve the problem. One general thing I would say is from our research in Access Medicine Foundation, we found that more companies are looking to improve early planning for access to future products that are in development. So there's definitely a lot more partnerships that are being developed where companies are making efforts to ensure that the products are made available in low and middle income countries. The scale and scope of the countries is still very limited, but the intentions are definitely growing over time, not fast enough for patients. to receive treatment. But I do think that this is a stepping stone that helps us all achieve access in a better way. And this cannot be done without voluntary licensing mechanisms. And the voluntary licenses themselves will look different from what we've seen for HIV. But as some of the previous speakers have said, it's not only the license itself, but the supporting terms and negotiations that are there and the partnerships that are there that support the IP arrangements that will make a difference between life and death for patients.
Thank you, Jay. So just a year ago, MPP signed licenses with Merck for molnupiravir and with Pfizer for nirmatrelvir. And these are treatments for COVID-19 that are now recommended by WHO. Multiple companies took a sublicense from the MPP for the development of nirmatrelvir, ritonavir, and Hetero is one of these companies. And Hetero is a longtime partner for MPP through licenses, multiple licenses for HIV and viral hepatitis drugs. So Rahul, our next question obviously is for you. In December, Hetero received WHO pre-qualification for the generic version of nirmatrelvir ritonavir. And this was something that you have developed through a license from MPP in record time. So for you, what are the main challenges for Hetero in developing and providing or facilitating access to treatments in this pandemic period? And how is that different for HIV products? And the second question would be, what do you think could be MPP's role in preparedness and response for the future?
Thank you. Good evening, good afternoon, everyone. First of all, thanks a lot for inviting us for this important event. And I call it important event because I just looked at the framework strategy and it looks very good. I mean, I'm very much glad to see NCDs and biologicals on your radar. So that was one of the asks that I would have said in the previous panel. So thanks a lot for including that. Yes, as you said, Hetero has been a long-standing partner with MPP. We have several voluntary licenses through MPP across therapeutic areas, HIV, hepatitis, and more recently COVID-19. Yeah, I mean, taking license is one thing, but making the treatment accessible to the patient is another. There is a huge loop that one need to close. And there is a lot of support that is needed from a lot of stakeholders, NGOs, public health organizations, governments, regulators, innovators, and MPP, of course. So we represent generic company and we help innovation meet the global reach for wider access. So innovation is, of course, important, and MPP enables that innovation get to the generics, and generics help that innovation reach to the wider people. We have worked in HIV, we have worked in Hep C, we have worked now in COVID. And I would say that working in COVID therapeutics was totally different experience than working in HIV and Hep C. I say that for reasons because there was more panic, there was more exposure among the countries, among the people. No one was really aware that whether they are going to get this infection or not. So people were really panicked. And of course, we also had to take care of our own people's health, our own employees' health and safety, while we were, ensuring that medicines are manufactured and reaching where they are needed. So there are a lot of challenges. We had logistical challenges. There were a lot of ports closed in the countries. Of course, there was panic among our own employees to come to the office and work in the normal conditions. There was a material availability challenge in terms of manufacturing key products. So all these challenges, I think, have motivated us. I would say they have not put us down, but they have motivated us to put in extra effort to develop the product in record time. There is a whole ecosystem in the organization available now to fast track the development of product, and I would also like to take this opportunity to thank regulators who have really evaluated and approved the product in record time. They have really stepped up to address this pandemic. And so I would say COVID-19 has really taught us a lot of things, and us means all the stakeholders, Innovators came to the front with their licenses. MPP enabled those licenses to generics, and generics also really stepped up in developing a product at record speed, and regulators approving them. So countries also approached a lot of different countries also approach different ways in terms of emergency use approvals. So there are a lot of lessons that we have learned in this pandemic. And coming to your second question, what MPP would do, if I was on the first panel, and if there was one sentence that I was asked for MPP, I would have said include more number of countries in the territory, and especially middle income countries, because I think those have been missing, and there is a huge pool of population who's getting impacted. So access is one thing that MPP really works for, and including more number of countries would help that. Second, in terms of COVID treatment, I would say there was panic in the country, in a lot of countries, and they wanted product as early as possible for their people. And because of the obligations in the license, we had to wait until the product is SRA approved before commercialization. So if there is any mechanism available and flexibility available in the license agreement to make it possible that the countries get the medicine at the time when it is needed the most, it's something that MPP can really work on. Thank you.
You need to prepare for another answer, because I was going to ask you at the end to also tell us one thing that you want MPP to do. All right, so I'll move to the next, or rather the last goal in our strategy. As MPP began to work on mRNA vaccine technology, other biologics, and more complex formulations of long-acting medicines, MPP's technology transfer role was reinforced with the establishment of a dedicated team to broaden the range of technology transfer services that MPP offers. So my question is to Martin. You are leading the mRNA technology transfer program at WHO. So our questions are, why is technology transfer so important? And what do you think MPP's role can be in supporting technology transfer for key health technologies going forward? Over to you.
So I've got 2 hours to answer that, I understand. Okay, so a license without the know-how means nothing in the countries where the products are the most needed. So as we start looking at the monoclonal antibodies for the treatment of cancer, the emerging monoclonal antibodies, most of the low and middle income countries do not have the know-how of how to produce this. So if we just give a license for this, if we give a license for a pandemic vaccine, be it a COVID vaccine, be it a pandemic influenza vaccine, in many countries, this will serve no purpose whatsoever, because the manufacturers on the ground do not have the know-how of how to translate that license into a product. So this requires that we actually build a technology transfer program. Now, when we work with the originators and we try and get tech transfer from the originators, this is typically a bilateral. They will work with 1, maybe 2 recipients that are competent, that are able to receive the technology. And what this does, this reinforces inequity, because those countries, let's take the whole of Africa, 54 countries that lack the capacity to produce biological molecules at high quality, they will not get on their foot onto the ladder. So we absolutely need to not only be providing licenses where necessary, freedom to operate where possible, but to be providing the actual know-how that goes with this. So I worked with Mary Paul Keeney many years in the past on pandemic influenza technology transfer. And we were moderately successful, but what we realized in doing this is that behind this, we also need to make sure that we've got agreements in place that bind those that are developing the technology, transferring the technology, to an access outcome. And so this is where Medicines Patent Pool really comes into its own of understanding how to use these agreements, understanding the IP issues, and ensuring that this is attached to outcome. So it is a real delight to see that Medicines Patent Pool has now brought in a technology transfer team for the moment on mRNA. This is critical to expanding the know-how around mRNA, but later for monoclonal antibodies, which will result in cancer therapies, will result in therapies for a lot of unmet needs. So this all comes down to inequity. Unless we treat this as addressing inequity, licenses will only reinforce those that have the know-how and not those that don't have it. So it's been a pleasure working with MPP. I look forward to many more years of working with you on technology transfer.
Thank you so much, Martin.
Nyabonga.
As with the first panel, we'll be asking you to tell us one thing that you want MPP to do in this next strategic period, 2023 to 2025. If you have one ask, what would that be?
What other than better coffee machines? I think expanding the tech transfer program. This is going to become essential. So I really hope that in the next phase, there will be an expansion beyond vaccines into monoclonal antibodies, expanding the team, expanding the know-how, also bringing in additional supplementary know-how, such as regulatory know-how, business planning know-how into this, because we need to be providing countries not only with the know-how, but everything goes around it to do with market access. Otherwise, it will fail.
Of course, I would still continue with my first ask to include more number of countries. And second, I would say, as Helen said, one size does not fit all. MPP needs to really look at the therapeutic category that they are working on a license, and then modify the agreement and clauses accordingly. Like if it is a pandemic, then don't wait for SRA approval. You look at some sort of quality assurance. I understand that patient cannot get the substandard quality of medicines, but some sort of quality assurance so that access is fast-tracked. So little bit of tweaking and a tweaking of clauses in the agreement as per the demand, as per the therapeutic category needs is my ask for MPP. Thank you.
I think we've clearly understood that the biotherapeutics are there. Many therapeutic products are there or will be coming soon into the market. And we also know that the patients are waiting. So our job is to glue as many originators and generics towards the medicines patent pool as possible. And I hope you use our partnerships like ours and others to influence the people who need to make decisions to negotiate with you hard so that patients get access. And I think on MPP has to remain flexible, adaptable, and agile to be able to provide the level of flexibilities in order to make this happen.
Without committee engagement in access negotiations, prevention products will gather dust in clinics' shelves and continue to involve us so that we continue to be engaged and we continue to spread the message within our communities, and then they will understand. Thank you.
So as said earlier, for those watching online, please feel free to send your questions through the relevant tool. And for people in the hall, you can also please ask questions from everyone. I mean, from the staff of MPP that will be in the room after the session. So for those online, we'll try our best to respond to your questions after this meeting. So I'll take this moment to say a very big thank you to our audience. I mean, to our panel, for their responses, for their insights, for the very brilliant contributions that you have made this evening. And we look forward to working with you in the next 3 years. Thank you so much.
I would like to welcome Erika Platella to join me, the Head of Health at the Federal Department of Foreign Affairs and Swiss Agency for Development and Cooperation. MPP is based in Switzerland, and as our host country and funder, Erika is going to give the closing remark. Thank you, Erika.
Thank you very much for the invitation and the opportunity to say a few words from a donor perspective. So actually, our partnership dates back to 2029. if I'm not mistaken, 2019, maybe goes to, so 2019, and of course, we welcome MPP's increased focus on improving access to essential health products for NCDs, because that's one of our priorities. And we were the first donors investing in NCDs. I remember many years ago when it was the narrative was not really sexy and you don't really see the low-hanging fruit. So it was very complicated. It seems that the COVID-19 helped a lot, but we are not so far in terms of investing in addressing NCDs, including when it comes to IP-related issues, but also maternal health and specific pediatric formulations in this new strategic framework. So this is very much in line with Swiss international cooperation priorities in health, and especially the NCDs. Well, then facilitating the development and access to novel medical technologies, such as long-acting products, biologics, mRNA, vaccines. It's also a new strategic goal in this new strategy. And the COVID-19 pandemics, as it has been highlighted by in both panels, has shown that it is indeed important to develop suitable approaches to support affordable access to such technologies in LMICs. Again, this is a priority of our international cooperation, not only at bilateral level, but also within bilateral programs in many countries. Well, this is just an example showing I think that's the most important point about our partnership, is that it's just an example showing the agility of the MPP business model and operating model to respond to new challenges and to adapt to abrupt changes of context. Not all organizations have this capacity to adapt to new context, to be flexible, but at the same time to keep their core mandate. And there was a trend, also because of funding issues, to COVIDize everything. I mean, all organizations that they were thinking about pandemic preparedness and response, reaching out to donors. So you are among those partners who really stick to their core mandate and only extending, I mean, using your comparative advantage and not going beyond that, because it's not possible. The fiscal space is not that big. So donors don't know. I mean, new funds are now being set up. So it's very important to invest in partnerships which are already showing a lot of results, and including, I mean, just adjusting your mandate to be ready for the next pandemic is very important. It's very cost effective from a donor perspective. So that's a very important point. And then MPPs is the world leading organization promoting better access and facilitating the development of medical products, while at the same time protecting intellectual property rights. This is very much, again, in line with Switzerland's position in this regard. It's beyond international cooperation. It's Switzerland's position also when it comes to global negotiations and global positioning in this area. Well, we think that our support to MPP reflects the Swiss commitment to promoting voluntary licensing as a practical and non-controversial alternative solution in response to urgent and most pressing challenges in accessing health technologies in LMICs. So this non-controversial aspect of your work is very important for Switzerland, because otherwise we don't see any. I mean, the vehicles we have are very limited to work with the pharmaceutical, with the pharma, and engaging in beyond voluntary licensing. It's very difficult for us. And then partnerships. We are convinced that only a multi-stakeholder framework will lead to successful access. Actually, voluntary licensing, and it has been widely highlighted in both panels. Voluntary licensing cannot be reached alone, and it's really important to work with partners ranging from governments, innovators, pharmaceutical industry, generic manufacturers, international organizations, civil society, and of course, donors. And we remain fully committed to building up to 2029 to building strong multi-stakeholder partnerships as a key enabler for SDG 3 and to move the 2030 agenda forward. Thank you very much again for being among our partners, actually, which have, I think, the most obvious added value in our portfolio. Thank you.
Thank you, Erica, for your encouraging remarks and your continuous support. So we've come to the end of this event. On behalf of all MPP, we'd like to thank you all, both those in the room and those online, for joining us. Please do send questions to the address on the screen, or let's discuss in the room. For those in the room, don't forget that we have a Vox box at the end of the room to record short messages for MPP in this context of the upcoming period. And that's it. Thank you all and goodbye.